After my first baby, I cried on the toilet for 3 days because nobody told me how painful that first bowel movement would be. I bled for 6 weeks straight. My body felt completely foreign, and I was shocked that nobody had warned me about any of it. Today, I'm sharing everything about postpartum recovery that I wish someone had told me before I gave birth. The real, unglamorous truth about what happens to your body in those first 6 weeks. Because you deserve to be prepared, not blindsided. Hey everyone, I'm Diana, and welcome back to Sweet Pregnant. I'm a doctor specializing in women's health, and I'm a mom of 3. And here's what I've learned. We spend 9 months preparing for labor and delivery, but almost no one prepares you for what comes after. The postpartum period is this weird time where everyone is focused on the baby, and you're expected to just bounce back. But your body has been through something massive, whether you had a vaginal delivery or a C-section. You need time to heal. You need support. And you need to know what's normal and what's not. So today, I'm walking you through the first 6 weeks postpartum, week by week. What to expect physically, what you can do to help yourself heal, and when you need to call your doctor. Let's start with what happens immediately after delivery. Right after you deliver your baby, whether vaginally or by C-section, your body immediately starts the recovery process. But it doesn't feel like recovery. It feels like you've been hit by a truck. What's happening in your body? Your uterus starts contracting back down to its pre-pregnancy size. These are called afterpains, and they can be surprisingly intense, especially if this isn't your first baby. With my first, I barely noticed afterpains. With my second and third, they were strong enough that I needed pain medication. You'll start bleeding heavily. This is called lochia, and it's your uterus shedding the lining that supported your pregnancy. We'll talk more about this in a minute. If you had a vaginal delivery, your perineum, the area between your vagina and anus, is going to be sore. Even if you didn't tear, the tissue has been stretched and stressed. If you did tear or had an episiotomy, you'll have stitches. These stitches will dissolve on their own, but they're going to be uncomfortable for a while. Sitting, standing, walking, even going to the bathroom is going to hurt. If you had a C-section, you've had major abdominal surgery. You'll have a horizontal incision across your lower abdomen, and it's going to be painful. Moving from lying down to sitting up will be difficult. Coughing, laughing, or sneezing will hurt. Getting in and out of bed will require help. In the hospital, the nurses will check your bleeding regularly. They'll press on your abdomen to make sure your uterus is contracting properly. This is uncomfortable, but necessary. Help you to the bathroom for the first time. This is a big moment, and it's okay to be nervous. Encourage you to get up and walk as soon as possible. Movement helps prevent blood clots and speeds healing. With a C-section, they'll have you up and walking within 12 to 24 hours. It feels impossible, but it really does help. Let's talk about lochia because this is something that really surprised me. You're going to bleed heavily for the first week or 2. I'm talking soaking through a pad every couple of hours. The blood starts out bright red, then gradually turns pinkish brown, then eventually yellowish-white over the course of 4 to 6 weeks. What's normal? Heavy bleeding for the first few days. Passing small clots, especially when you first stand up after lying down. The bleeding gets lighter over time, though it might increase temporarily when you're more active. What's not normal and requires a call to your doctor? Soaking through a pad in an hour or less. Passing clots larger than a golf ball. Foul-smelling discharge, fever along with heavy bleeding. These could be signs of postpartum hemorrhage or infection, and they need immediate attention. Now let's talk about the thing nobody warns you about, that first bowel movement. I was terrified. I had stitches, everything down there hurt. And the last thing I wanted to do was push or strain. But you have to go eventually, and the longer you wait, the harder it gets. Here's what helped me. Stool softeners. Start taking them immediately after delivery. The hospital should offer them. If not, ask. Drink tons of water. You need to stay hydrated anyway for healing and milk production, but it also keeps your stool soft. Don't wait too long. When you feel the urge, go. Don't put it off out of fear. Use a squatty potty or stool to elevate your feet. This changes the angle and makes it easier. Support your perineum with a clean pad or folded toilet paper. Apply gentle counterpressure. This will make you feel more secure. Breathe. Don't hold your breath and strain. Take slow, deep breaths and let things happen naturally. With my first baby, I waited 4 days and it was awful. With my second and third, I went on day 2 and it was so much easier. Trust me on this, don't wait. If you delivered vaginally, your perineum needs special care. This area has been stretched, possibly torn, and it's going to be sore for a while. Here's how to take care of yourself. Ice packs for the first 24 to 48 hours. In the hospital, they'll give you these weird pad-shaped ice packs. Use them. The cold reduces swelling and numbs the pain. At home, you can make padsicles. Take maxi pads, soak them in witch hazel, add a little aloe vera gel, wrap them in foil, and freeze them. Then stick one in your underwear. The cooling sensation is incredible, and the witch hazel promotes healing. Sitz baths starting after the first couple days. A sitz bath is when you sit in a few inches of warm water for 10 to 15 minutes. It increases blood flow to the area and promotes healing. You can do this in your bathtub or by a special basin that fits over your toilet. I did sitz baths 2 to 3 times a day for the first 2 weeks. They were the only time I felt any relief. Peri bottle. The hospital will give you a squirt bottle. Fill it with warm water and use it to rinse yourself every time you use the bathroom. Pat dry gently with toilet paper. Don't wipe. Patting is much less painful. Witch hazel pads. After you rinse and pat dry, you can apply witch hazel pads directly to the area. They're soothing and help with healing. Pain medication. Don't try to be a hero. Take ibuprofen or acetaminophen as directed. Both are safe while breastfeeding. I took ibuprofen around the clock for the first week. When to call your doctor? If the pain is getting worse instead of better. If you see signs of infection, increased redness, swelling, pus, or foul smell. If your stitches come apart or you feel something bulging from your vagina. Most perineal pain improves significantly within 2 weeks. By 6 weeks, you should feel mostly back to normal down there. If you had a C-section, you're recovering from major surgery while also taking care of a newborn. This is incredibly challenging. Give yourself grace. How to care for your incision. Keep it clean and dry. You can shower. Let the water run over the incision, but don't scrub it. Pat it dry gently with a clean towel. Don't submerge it in a bath until your doctor says it's okay, usually around 2 weeks. Watch for signs of infection. Increased redness or swelling around the incision. Pus or discharge from the incision. Fever. The incision feels hot to the touch. Increased pain instead of decreasing pain. If you notice any of these, call your doctor immediately. Support your incision when you move. When you cough, sneeze, laugh, or stand up, hold a pillow firmly against your incision. This provides support and reduces pain. I kept a pillow with me everywhere for the first 2 weeks. Avoid heavy lifting. You shouldn't lift anything heavier than your baby for at least 6 weeks. That means no toddlers, no laundry baskets, no groceries. I know this is hard, especially if you have older kids, but lifting too soon can cause complications. Expect numbness around the incision. The nerves in that area have been cut, and it can take months or even years for sensation to return. Some areas might stay numb permanently. I had a numb spot above my C-section scar for over 2 years. By 6 weeks, your incision should be well healed, though it will still be pink or red. Over the next year, the scar will fade and flatten. Around week 2, your hormones absolutely plummet. During pregnancy, your estrogen and progesterone were sky high. After you deliver the placenta, those hormones drop off a cliff. At the same time, prolactin, the hormone that produces milk, is surging. This hormonal roller coaster causes night sweats. You'll wake up drenched in sweat. This is your body getting rid of all the extra fluid you retained during pregnancy. I had to change my sheets every night for about 2 weeks. It was intense. Hair loss. Around 3 to 4 months postpartum, you'll start losing hair. A lot of hair. This is normal. During pregnancy, your hair stayed in the growth phase. Now it's all falling out at once. It's alarming, but it will stop. I thought I was going bald with my first baby. Mood swings. The baby blues hit about 50 to 80% of new moms around day 3 to 5. You'll cry for no reason. You'll feel overwhelmed, anxious, and emotional. This is temporary and usually resolves within 2 weeks. But if it doesn't get better or if it gets worse, that's postpartum depression and we need to address it. I'll do a whole video on that. Emotional intensity. Everything feels bigger. You might feel overwhelming love for your baby. You might also feel scared, inadequate, or resentful. All of these feelings are normal. You're not a bad mom for having complicated emotions. What helps? Talk about it. Tell your partner, your mom, a friend. Don't suffer in silence. Rest as much as possible. Sleep deprivation makes everything worse. Eat real food. Your body needs nutrients to recover. Accept help. If someone offers to bring you a meal or hold the baby while you shower, say yes. Be gentle with yourself. You just did something incredible. You're allowed to struggle. By week 4, you should start feeling more like yourself. The bleeding has probably slowed down significantly. If you had a vaginal delivery, the perineal pain should be mostly gone. If you had a C-section, you're moving more easily, but you're not fully healed yet. You still need to be careful. What you can do. Light activity. Walking is great. Start with short walks around your neighborhood and gradually increase the distance. Walking helped me so much mentally and physically. It got me out of the house, gave me fresh air, and helped my body recover. Pelvic floor exercises. You can start doing Kegels once you're cleared by your doctor, usually around 6 weeks. Kegels help strengthen the pelvic floor muscles that were stretched during pregnancy and delivery. To do them, squeeze the muscles you'd use to stop peeing. Hold for 3 to 5 seconds. Release. Repeat 10 times, 3 times a day. What you should not do yet. Heavy exercise. No running, jumping, or high-impact activities until your 6-week checkup. Core exercises. No crunches, planks, or anything that puts pressure on your abdominal muscles. If you had a C-section, you need to give those muscles time to heal. If you had a vaginal delivery, you might have diastasis recti, which is separation of the abdominal muscles, and it needs to heal before you start core work. Sex. This is a big one. You should wait until after your 6-week checkup to have penetrative sex. Your body needs time to heal. Your cervix needs to close. Your uterus needs to shrink back down, and if you have stitches, they need to fully heal. I know 6 weeks feels like forever, especially if your partner is ready before you are. But rushing it can cause pain, bleeding, and complications. And honestly, even at 6 weeks, you might not be ready. That's okay too. When you do start having sex again, use lubrication. Breastfeeding lowers your estrogen, which causes vaginal dryness. And use birth control. Yes, you can get pregnant before your period returns, even if you're breastfeeding. At 6 weeks postpartum, you'll have a checkup with your OB or midwife. This is an important appointment. Don't skip it. What they'll check: your bleeding. By 6 weeks, the lochia should be minimal or gone. If you're still bleeding heavily, they need to know. Your incision or perineum. They'll check that everything has healed properly. Your blood pressure. Preeclampsia can develop postpartum, so they'll monitor this. Your emotional state. They should ask about your mood, sleep, and how you're coping. Be honest. Your cervix and uterus. They'll do a pelvic exam to make sure your uterus has returned to its normal size and position. They'll also discuss birth control. What are your options? What works while breastfeeding? Exercise. When can you return to your normal activities? Sex. Are you cleared to resume? Any concerns you have? This is your chance to ask questions. Don't hold back. Use this appointment to advocate for yourself. If you're still in pain, say so. If you're struggling emotionally, tell them. If something doesn't feel right, speak up. This appointment is about you, not just about the baby. You matter too. Here's what I want you to remember. Postpartum recovery takes time. 6 weeks is not a magic number where everything is suddenly back to normal. Your body has been through something enormous. It grew a human. It delivered a human. It needs time to heal. Be patient with yourself. Don't compare yourself to celebrities who look like they never had a baby 2 weeks postpartum. That's not reality. Don't push yourself to bounce back. There's no timeline you need to meet. Listen to your body. If something hurts, stop doing it. If you're exhausted, rest. If you need help, ask for it. And please, call your doctor if your bleeding suddenly gets heavier, you develop a fever, you have severe pain that's not improving, you feel hopeless, worthless, or like you can't take care of your baby. These are all signs that you need medical attention. You are not alone in this. Postpartum recovery is hard. It's messy. It's uncomfortable. But you will get through it. And eventually, you'll start to feel like yourself again. Maybe a different version of yourself, but yourself nonetheless. If this video helped you feel more prepared, hit that subscribe button. My next video is about postpartum depression versus baby blues and when you need to get help. Drop a comment and let me know. What's your biggest question about postpartum recovery? Let's help each other. You've got this. You're stronger than you know. I'll see you in the next one.